Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. National Primary Healthcare Development Agency signs MOU with civil society organization on accountability project for COVID-19 financing. Group donates oxygen cylinders to 4 general hospitals in Jigawa State. And Duchess of Cornwall tests positive for COVID-19, goes into self-isolation. Thank you for joining us. Today marks 2 years since the first COVID-19 case was detected on the African continent. Egypt notified the world on the 14th February 2020 that the confirmed case was a contact of a person with a history of travel to China. 3 days later, the Ministry of Health, Population and Hospital Reform of Algeria reported the country's first case of an Italian adult who arrived in the country on the 17th of February 2020, and that was Africa's second case. And by the end of the first week of March, 9 African countries, Algeria, Cameroon, Egypt, Morocco, Nigeria, Senegal, South Africa, Togo and Tunisia were reporting over 40 cases. Most index cases originated in Europe, where the epicenter had shifted, driving early spread of the pandemic on the African continent. But now, according to the World Health Organization, if current trends continue, the region is on track to control the COVID-19 pandemic this year. But there must be continuous testing, surveillance, and increasing vaccine uptake. Here's more on the COVID-19 update.
38 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states. That's an increase from figures reported earlier. Lagos accounted for the highest number of cases with 19 infections. Imo had 10, Plateau 3, Nasarawa and Osun states logged 2 cases, while Kaduna and Ogun states logged 1 case each. The total confirmed cases in Nigeria now stand at 254,016. The report also includes a backlog of cases from Lagos State, as well as 0 cases from Abia, Bauchi, Delta, Ekiti, FCT, Kano, Oyo and Sokoto states. 74 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,397. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,141. Currently, there are over 20,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by Benue and Nasarawa states. Over 16.5 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 6.9 million of the population have been fully vaccinated. In Africa, over 11 million persons have tested positive, while over 244,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 411 million, while deaths are now beyond 5.8 million.
One of the ways to addressing the many challenges of the nation's primary healthcare system is through the active engagement of civil societies to monitor and evaluate the plight of Nigerians, especially at the grassroots and in the wake of the COVID-19 pandemic. These were the words of the Executive Director of the National Primary Healthcare Development Agency, Dr. Shoaib, who was speaking at the MOU signing ceremony with a civil society organization connected to development, led by its Chief Executive, Hamza Lawal. Dr. Shoaib identifies poor manpower and lack of infrastructure as some of the challenges that must be tracked by civil society organizations to improve transparency and accountability.
We welcome this collaboration because it's also an opportunity for us to hear from the people that we serve. Because connected development represents community members, it is an opportunity for us to get feedback on how we can improve primary health care. We're very clear in our minds that one of the biggest challenges that we face in primary healthcare is a lack of adequate human resources. More than 70% of the primary healthcare centers across Nigeria still do not have the full complement of health workers that are required. More than 70% of the primary healthcare centers do not have the right infrastructure, the right equipment, the right drugs, the right utilities. Yet, primary healthcare workers all over the country are doing the best that they can in very, very difficult circumstances. Collaborations such as this will not only provide civil society organizations with an opportunity to have access to data, to have access to the reality that people face in primary healthcare centers.
Meanwhile, the provision of an oxygen system is key to saving the lives of patients suffering from breathing-related diseases such as COVID-19. And Dr. Adamu Issa, the chief of Party Inspiring Project, is spearheading the flag-off of the distribution of oxygen cylinders and other items to 4 general hospitals in Jigawa State. Our correspondent Sadiq Ilyasu has more.
Since the outbreak of COVID-19 pandemic, the need for sustainable access to medical oxygen has been growing in some countries, which are already facing limited supply. In Jigawa State, authorities are making a move to remedy the situation as 4 general hospitals receive donations of oxygen cylinders and oximeter to assist patients with underlying diseases, especially those relating to breathing.
Save our children, men and women in Jigawa State. Thank you very much. This is the first batch of beneficiaries from our interventions, and I can assure you if we receive additional funding, we will also consider the other general hospitals.
The Director of Hospital Services, who is representing the Permanent Secretary, Ministry of Health, is grateful for this gesture.
We all know medical oxygen is not only air, as the chief of party puts it. It is something that is very vital and something that supports and sustains life and is life-saving. All these gadgets you see, the gadgets are life-saving gadgets, and no matter how much it is put to procure these gadgets, it's not something that we say it is too much.
Although the state has in recent times recorded fewer cases of COVID-19, the state government believes that these donations will go a long way in saving lives of patients in need of oxygen support and further strengthen their capacity in managing COVID-19. Sadiq Ilyasu, Channels Television News.
And many people around the world have questions about COVID-19 vaccines. As the COVID-19 pandemic continues, experts learn more about the virus and virus variants that cause COVID, along with how the vaccines are working in real-world conditions. We now speak to an expert on some of the frequently asked questions on COVID-19 vaccines in the country. Dr. Basio Kosem-Bassi is the Director, Disease Control and Immunization with the National Primary Healthcare Development Agency, joins us from our Abuja studio. Welcome, Doctor. Thank you for joining us on the program.
Thank you, Melissa, and good evening, Nigerians.
Good evening. So one of the obvious questions at the beginning used to be, why do I need to wear a mask or avoid close contact if I'm vaccinated?
Well, you know, when you are not covered, you stand a chance of breathing the air as raw as it is. And we know that the air that we're breathing in is also filled with contaminants. The air that blows through the soil picks up the dust, picks up all sorts of things. And then people that are infected cough into the air. And so if we are picking those air raw as it is, we stand chances of picking up pathogens, or in other words, bacteria, viruses, and so on that can cause diseases. So this is why we need to protect. Of course, we know, for instance, the COVID we are talking about, when one is infected with it and is coughing or spitting and things like that, it's contaminated with the virus. And of course, if you cough, it can travel that distance, and if you are close to somebody who is infected and it coughs, the chance of breathing straight and picking the virus is also there. So the need for us to use a mask, and those masks prevent us from breathing the air directly, the air is being filtered and we have the fresh air being taken into the body and it's less contaminated.
So, Doctor,
that is why we need to protect ourselves.
So even with the MPIs, you're saying that the vaccine is safe, but it does not protect against COVID-19, the virus.
No, the vaccine is very protective. Very, 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 very safe and protective. What the virus or the vaccine does is this. I'll first liken it to what we see in the children and then bring it to the adult. You know our children, we give them vaccines against vaccine-preventable diseases. For instance, at 9 months, we give that child measles vaccine. That vaccine prevents that child against the measles virus. So if the child is now meets the real-life virus, the chances of coming down with the disease is not there because that child is protected. For us adults, and as per the discussion at this point now, the COVID-19 virus, once we take the vaccines have, once it's taken, it boosts our immunity. The body develops antibodies that at any point that we are faced with the live wild virus, the antibodies we have developed from the vaccine fight and destroy that virus and not giving it a chance to cause disease in the body. Now, once you take a first dose, from the very first dose, what statistics have shown so far, first dose alone, about 62 to 67% of the adults develop immunity. And then by the time you take a second dose, about 82 to 89% develop full-time protection against it. And with a booster, it takes this to about 94 to 96%. So what it does is, by the time an adult take the vaccine, the immune system is stimulated, antibodies are produced. These antibodies are the ones that fight the real live wild virus anytime the person is exposed to the virus. And somebody that has taken the vaccine is protected. If at all it comes into takes in or is being contaminated, infected with the real live virus, what will happen is that you will see that person most commonly will be asymptomatic, and even if the person did not yet develop full immunity protection to it, if he comes down with the virus or is being infected with the virus, the symptoms will be very mild and not as severe as somebody who has not taken the vaccine. What the NCDC statistics is showing us so far is that for the cases we are seeing commonly, remember today, as also mentioned earlier, confirmed in the lab is about 254,016 persons. And of course, we've lost 3,141 Nigerians to this virus officially. Now, the number of cases we have seen so far, 91% of those cases are reported in people who never took the vaccine. The remaining proportion we are seeing are in people who have taken the vaccine but are yet to complete. But even in them, the cases are mild. So if you take the vaccine, you stand a chance of being protected. And if you come in contact with the real wild virus, you become asymptomatic. And if you're among the full proportion that are yet to develop full immunity, then those are the ones that will see positive with mild symptoms of the COVID, like fever, headache, tiredness. In few days is all over. But if the person did not take the vaccine at all, of course, that is where we have the most severe cases. And as I just mentioned, 91% of the current cases we are seeing are from those who never took the vaccine. That is the situation. The vaccine is very effective, safe, and is free currently.
All right, I have a long list of questions, but it means that you have to come again to dispel some of these myths. We appreciate your time. Thank you so much, Dr. Bassey. Okpose Bassey is the Director, Disease Control and Immunization with the National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you so much, Ms. Zane. Thank you, Nigerians.
Well, still to come, the United States is seeing a drop in cases. We'll tell you more when we return. Welcome back. Omicron is the dominant variant in the United States, accounting for nearly all COVID-19 cases. Severe outcomes from Omicron appear lower than during previous periods of high COVID-19 spread, due parts to COVID-19 vaccination and boosters. While the U.S. for the past 30 days has seen a decline in the number of COVID-19 cases and is asking for changes to mandates and COVID-19 regulations. Our Washington correspondent Maria Bird brings us this update.
During the U.S.'s largest sporting event, the Super Bowl, anti-vaccine protests surround the SoFi football stadium in Los Angeles.
I am here today because there is no emergency. 70,000 plus people will be here at the Super Bowl today, and 600,000 of our kids will have to show up at school tomorrow with masks on for 6 hours a day, 5 days a week for almost 2 years straight. It's wrong.
They're sick of it in Canada. We're sick of it here, and nobody wants to say it. So we're here to help people have courage to say no.
While U.S. COVID-19 cases continue to drop, protests against mandatory vaccinations and controversy over children wearing masks in schools increases. The CDC gives clear guidelines on why they recommend that children wear masks.
We have and continue to recommend masking in areas of high and substantial transmission. That is essentially everywhere in the country in public indoor settings. I'm pleased to say that about 96% of our children are in schools and that the masking has allowed them to be in school safely.
The U.S. may be in a better position than it was 2 weeks ago with the reduction in the number of cases and hospitalizations, but medical professionals are warning Americans that they cannot let their guard down. From Washington, Maria Bird, Channel Television News.
And our correspondent Maria joins us now. Hi, Maria. I mean, it's been weeks of angry protests from Canada and the border to the United States, shutting down the largest border crossing. Tell us, what's it looking like now?
You know, at this time, they've been able to remove various cars and trucks and individuals that were protesting from that bridge area. And so there's obviously been arrests that have happened in this area, but at this time they're definitely clearing out from the protesters.
So we heard the director of the U.S. Centers of Disease Control and Prevention say that it's still too soon to loosen COVID-19 prevention restrictions. But we're also hearing some states have relaxed their rules. With the current numbers, what do you think is going to happen?
With the current numbers, it looks as if we are definitely heading into a better position. You know, obviously, the hope is that there's not another variant that creates a challenge for the direction the U.S. is moving in. But we're moving into warmer months in most parts of the United States, and so that will also help to decrease the number of cases. The real question, though, is whether or not a relaxing on some of the regulations will not potentially have an adverse effect on what we're seeing in a decrease in the spread.
But are there some regions that are doing better than others?
Definitely. There are regions in the eastern region, the Midwest and the southern west area of the U.S. have continued to struggle with cases, but they are too still seeing some decreases, but their rates have gotten so high that they still are not in the same position as many of the eastern region, the northeast region, and the far west north of the U.S.
What are the rules concerning indoor mask mandates?
It depends on the region. So in the Washington, D.C. area, there are still mask mandates for indoor, but New York just relaxed their indoor mask mandates here just this past weekend. And so you're seeing areas like that across the U.S. which are beginning to relax their masking mandates.
So talk to us about COVID-19 hospitalizations dropping. I mean, are there other problems? Because we've heard about staff shortages, for example.
Yeah, so the staff shortages are the #1 concern for hospitals across the U.S. Nurses have had to travel across the country to assist hospitals that have high rates of hospitalization to ensure that we're able to have enough staff, and obviously staff contracting the virus and being able to come back to work. A lot of people are hoping that the vaccine rates increase and the mandates for medical professionals to be vaccinated will potentially decrease the longevity of how long someone is actually sick with the virus, and then allows them to be able to come back to work in less than 7 or 10 days. And what we're seeing now is an average, if someone does contract the virus as a medical professional, is 3 to 5 days before they're able to return. So that is obviously helping with some of the medical professionals' challenges with having staffing within the hospitals.
What about the vaccine mandates?
The vaccine mandates for medical professionals is obviously, making many of those who are coming into the hospital more comfortable. And it's also ensuring that they're not getting the virus and having to be hospitalized themselves, or oftentimes, unfortunately, losing their lives if they do contract the virus. So that is helping in that area. The mandates are also helping for those frontline workers. And as we can see here, many of the truckers were not happy, obviously, with those vaccine mandates, but it's also helping because we have seen an issue with supply chain in the U.S. just because we don't have enough workers to transport goods across the U.S.
Let's talk about children. What is the status of vaccines for children under 5?
Children under 5, there is a hold right now on approval of the vaccine for children under 5. It is expected that by late spring, that should be available for children under 5. And obviously, many parents are eager to get those younger children vaccinated because they are right now the only group that does not have access to the vaccine, and obviously very vulnerable. And the contraction rates for younger children is much higher just due to the fact that they're not as diligent with mask wearing or the 6 feet separation.
All right, our Washington correspondent Maria Birdlife for us. Many thanks. The Duchess of Cornwall has tested positive for COVID-19 and is now in self-isolation. The 74-year-old's result comes days after her husband, the Prince of Wales, tested positive for the virus on Thursday. She, Camilla, had carried out 3 public engagements on that day after testing negative. Prince Charles met the Queen 2 days before that, but a royal source said on Thursday that she was showing no symptoms. Well, here's more on the Global Update.
This will be the first time the Duchess has caught the coronavirus, while Prince Charles has the virus for a second time. On Thursday, the Duchess had described herself as luckily negative during a visit to Thames Valley Partnership in Buckinghamshire, saying of her testing regime, "I've taken it so many times." As well as a visit to Buckinghamshire, the Duchess visited the Haven Paddington Sexual Assault Referral Centre in West London and opened the Nourish Hub Community Kitchen in Shepherd's Bush, where she added the finishing touches to a lubia polo, an Iranian rice dish being offered to refugees. This morning, Clarence House alerted the organizations Camilla visited and the media who covered her engagements. Teenagers in Russia have started receiving jabs of the newly produced Sputnik M vaccine as infection rates in the country have risen sharply. Russia's health ministry announced that a new version of the country's Sputnik vaccine would be made available to a younger age group of 12 to 19 years. Sputnik M has been developed for teenagers by Gamaleya Center. Russia's health ministry registered Sputnik M in late November 2021. Over in Israel, a freedom convoy drove along the main highway linking Tel Aviv and Jerusalem, inspired by protests in Canada against coronavirus restrictions. Protesters carried placards, some stood on overpasses and at intersections on the highway. Protesters carried placards, some stood on overpasses and at intersections on the highway, as the cars, some flying Israeli and Canadian flags, drove by. Outside Parliament, protesters sounded horns and beat drums and called for pandemic restrictions to be lifted. In recent weeks, Israel has rolled back requirements to show proof of vaccination at restaurants, movie theaters, gyms and hotels to coincide with a slowdown in daily infections from the highly contagious Omicron variant of COVID-19. Finally, South Korea's parliament has passed a bill allowing people who have caught the virus to cast their ballot in next month's presidential election. South Korea will elect its next president on March 9, but concerns about potential COVID-related disruptions are growing as daily cases skyrocket due to the spread of the highly infectious Omicron variant. The existing rules effectively ban people diagnosed with a contagious disease after the March 4 to 5 early voting period due to the mandatory isolation policy.
We have more updates on our website. It's channelstv.com. You can get a better understanding of the pandemic, plus other stories, breaking news, all at your fingertips. That's our program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.